Prescribing is one of the most important jobs of all the clinicians throughout their career, and for most, it is the major treatment modality. Therefore, I hope it is appropriate to talk about rational prescribing in this forum. Reason for concerns about rational prescribing is the increased irrational use of drugs, which is a worldwide problem, and prescribing is the major determinant of drug use. According to WHO, more than 50% of the medicines are prescribed, dispensed, or sold inappropriately, and half of all the patients fail to take them correctly. In developing and transitional countries, less than 40% of the patients in the public sector and 30% in the private sector are treated according to the treatment guidelines. This explains the need of rational prescribing to promote safe and effective use of drugs. Everyone knows what prescribing is, but many are not aware of the complexity of the process and importance of the components of prescribing. The Oxford Dictionary defined the word prescribe as advise and authorize the use of medicine or treatment for someone, especially in writing. One of the most commonly used definitions for prescribing is the so-called 5 rights: giving the right drug in the right dose, by the right route, at the right time, to the right patient. But all these definitions do not include some of the important aspects of prescribing, such as safety concerns, drug information, and cost analysis. Prescribing is actually not simply giving an order to buy or sell drugs. It's much more complex, and it's actually a difficult or complex task which requires skills and knowledge. Diagnostic skill is crucial for prescribing. One of the reasons for irrational prescribing is poor diagnostic skill. Once you made the diagnosis, the next step is choose the appropriate drug. So how are you going to choose? For which the prescribers should have wide knowledge on medicines and clear understanding of principles of clinical pharmacology, and they have to apply the scientific evidence in choosing appropriate medicine. Once you have decided on the treatment or treatment options, then you have to do a clear, individualized risk-benefit assessment for each and every patient. Communication skill is very important for prescribing, to get the history and come to a diagnosis, then discuss with the patient regarding the treatment options and give the drug information. So when we say rational prescribing, that should maximize the effectiveness, minimize the risk, minimize the cost or waste of resources, and respect the patient choice. So when you are not prescribing rationally, there will be low chances for the patients to get benefited. Polypharmacy is one of the important consequences of irrational prescribing. It is defined as concomitant use of multiple drugs, which is common. The cutoff number of drugs for polypharmacy is arbitrary. Usually it is 5 or 6. And polypharmacy commonly seen in elderly because they have multiple pathology. Even though polypharmacy is considered as one of the adverse consequences of irrational prescribing, it's sometimes appropriate. Unfortunately, in most cases, it is inappropriate. Another concern about polypharmacy is increased risk of drug-related problem, but there is no validated cutoff number of drugs to define what is the increased risk of drug-related problem. We can't say more than 5 drugs is going to give you much more drug-related problem. Sometimes 2 drugs can give much more problem than 5 drugs, because it also depends on type of drugs concomitantly used. So the consequences of polypharmacy or risks of polypharmacy, of course, increased risk of adverse drug reactions, drug-to-drug interactions, poor adherence, because too many drugs, then patient compliance tend to decline, and waste of money and resources. So how can we manage it? By using non-pharmacological approaches whenever possible, avoid prescribing for minor, non-specific or self-limiting conditions, regular medication review, simplifying the treatment, and talk with the patient about their concerns and problem and treatment options. Now, the important aspect is irrational use of antibiotics. It's a worldwide problem. Overuse is the major issue. For example, giving antibiotics for viral infections. Underuse is not a big problem, but sometimes it happens, especially when there's increased concern about increasing use of antibiotics. Sometimes clinicians tend to underprescribe. So another common problem is inappropriate use. The condition definitely going to require an antibiotic, but selection may be inappropriate. For example, selection of inappropriate for the condition, antibiotic for the condition, or inappropriate use of broad spectrum or intravenous antibiotic, or inappropriate dose or duration of therapy. Another important problem is promotion by drug companies. Others include lack of antibiotic policies and guidelines and regulation to control inappropriate use. So how can we overcome these? The consequences, obviously, the major and serious consequences, drug resistance. Others include cost and increased risk of adverse drug reactions. So how can we overcome? By educating the prescribers about the importance of use of antibiotics, encouraging them to restrict prescribing antibiotic to a limited groups of antibiotics, and promote review of antibiotic treatment during the course of illness and decide whether to continue or change the drug or discontinue. Audits and feedbacks on antibiotic use and improve diagnostic services, for example, culture and ABST. Developing and implementing antibiotic policies and treatment guidelines, including rational use of antibiotics in medical curriculum, regulation on quality and drug promotions. Another important aspect is surveillance of resistant pattern and using this surveillance data in clinical management and updating the treatment guidelines. So these are some of the suggestions to improve the quality of antibiotic prescribing. So other consequences of irrational prescribing are increased risk of adverse drug reactions and drug interaction, inappropriate treatment, waste of resources, losing patients' confidence, and more likelihood of litigations. So the contributing factors for irrational prescribing could be at the level of health system or at the level of prescribers. Lack of measurement of quality of prescribing, prescription, lack of evidence-based guidelines and prescription policies, inadequate training of undergraduate in prescribing, inadequate drug supply and health personnel, unethical promotion of pharmaceutical products are some of the important factors which contribute irrational prescribing. Prescribers, poor knowledge, lack of skills is one of the major reasons for irrational prescribing. Workload, of course, another problem for prescribers. When you too much of work, then you can't concentrate, they will be tired, they can't spend adequate time, so their quality of prescription is going to be affected. Then prescribing for incentives from pharmaceutical companies. So how we can improve this? By assessing the quality of prescription using standard tools and feedbacks to the prescribers, forming multidisciplinary national bodies to coordinate medicine use policies, evidence-based clinical guidelines and national prescribing policies and implementing them. Essential medicine lists should be prepared based on the prevailing conditions and their treatment of choice, which will make a more appropriate list, which will improve the quality of prescribing. Then problem-based training in pharmacotherapy and prescribing for undergraduates, continuous medical education for health professionals, adequate funding to ensure availability of medicines and health personnel, and appropriate and enforced regulations to control irrational drug use and prescribing. Now we will briefly go through some of the tools which are used in assessing the quality of the prescribing as well as drug utility. So one of the important tools is the WHO core prescription indicators. There are 5 indicators. Out of these, 4 could describe or explain the rationality of a prescription. Those are average number of drugs per prescription, percentage of prescription with antibiotics or injection, and percentage of drugs prescribed from essential medicine list or from national formulary. There are some WHO complementary indicators to assess the drug use indicators to assess the quality of prescribing, which include percentage of patients treated without drugs, average drug cost per encounter, percentage of drug costs spent on antibiotics and injection, prescription in accordance with treatment guidelines, percentage of patients satisfied with the health care they received, and percentage of healthcare facilities have the access to impartial drug information. Other tools include drug utilization 90, defined daily doses, and prescribed daily doses. Out of these, first two, the DU90 and defined daily doses, are commonly used in drug utilization studies and thereby to assess the quality of prescribing. So far, we have seen the importance of rational prescribing and how to promote it. Now, we will look it at from the point of view of prescribers. It's a very, for prescribers, prescribing is not an easy job. Actually, it is difficult because you have to consider many factors when you choose the drug for a particular person. Importantly, the patient profile, such as age, sex, weight, ethnicity, their comorbidities, drug therapies, smoking, alcoholism, etc. And also you have to consider the drug profile, such as pharmacokinetics, factors influencing the pharmacokinetics, drug interactions, adverse drug reaction, how to monitor the drug, etc. The most important and the most difficult part of the prescribing is choosing the appropriate drug. So how can it be achieved? So it is by using your knowledge. So you need to have sound knowledge on drugs, and you must understand the clinical pharmacology, and you must update yourself for current guidelines and current evidences on treatment. So by using this, you can choose most appropriate drug for the particular individual patient. Other problem is availability of the drug. Even if you choose the appropriate drug, if it is not available, then you have to go for the second best. So the best treatment cannot be given simply because of unavailability of the drug. Other one is lack of guidelines. So you don't know actually what to do for each condition. So lack of guidelines is another problem for the prescribers. And workload, of course, I don't know about the other countries, but this part of the world, it's still a big problem for the doctors, the workload. So definitely it's going to affect the quality of the prescription. So far we have seen the problems of the doctors. So how can we improve, or what are the remedies? I don't know how far the immediate changes can be made at the health system level. At least we can do something at institutional level. So here are some suggestions to implement at the institutional level to improve the quality of the prescribing. One is regular audits and prescription review and feedback to the prescribers. Use of flashcards for treatment options for common conditions. Clinical guidelines or treatment guidelines are quite extensive document, and most of the time, many doctors do not go through more than once, and it's difficult to go through each and every time. So making flashcards with the treatment of choice and alternative in a simplified manner for common condition will improve the quality of prescribing. And another important aspect is ensuring good prescribing practice in teaching hospital, because clinicians in the teaching hospital are the role models for the future doctors. So they have to be more careful than any other doctors. And finally, the prescription checklist. Each institution can have your own checklist and give it to your prescribers and to do self-assessment and improve the quality of the prescription. So this is a model checklist. Similar kind of checklist you can develop for each and every institution and give it to your prescribers or all the clinicians, so they can assess whether they are doing the right thing, and they can improve from this. Asking these questions, whether they can improve the quality of prescription. That's it. Thank you very much.